Good afternoon and hi everyone. Welcome to Improving Health Through Equitable Economic Development and Strategic Partnerships, a County Health Rankings and Roadmaps national webinar. So I want to start by acknowledging that County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. So my name is Justin Rivas, and I'm a community coach with County Health Rankings and Roadmaps. My colleague and fellow coach, Erica Burrows-Girardi, will be providing support throughout the webinar and will facilitate the Q&A at the end of today's webinar. Hi, Erica.
Hello, and thanks for joining us, everyone.
Thanks, Erica. Most importantly, I want to introduce our two guests on today's webinar. So first, we have Angel Ross, who is a program associate at PolicyLink, where they research and collaborate with local and national partners through the National Equity Atlas and the All in Cities Initiative. Angel specializes in leveraging data to support advocacy and to build the case for equity and racial economic inclusion. Hey there, Angel.
Hi, Justin. Hi, everyone.
Well, thanks for being here. And second, Dr. Jaime Torres is the Vice President of Community Relations and Partnerships at Urban Health Plan, one of the largest community health center networks in New York. He is responsible for facilitating, developing, and managing strategic partnerships. Dr. Torres is also president of Latinos for Healthcare Equity, a not-for-profit organization created to improve access to quality, affordable healthcare for the Latino community. Hi there, Jaime. Jaime may be on mute.
Okay. Can you hear me now?
Yeah, hey there.
I said hello and greetings from the Bronx.
There we go. Next, Erica will take us through some webinar logistics.
Thanks, Justin. If you have joined us on our webinars in the past, you know that we use GoToWebinar as a platform, and we're using new technology today, and it's called Zoom. So there are two changes I need to let you know about. The first one is that our handouts that you typically have, the handouts of the slides and the resources, will be uploaded along with the recording of this webinar tomorrow on our website. So you can look for those there. And the other thing I need to share with you is how you can communicate with us in Zoom. And you will see that at the bottom of your viewer window, you can see the Q&A box. This is the box that we would love for you to use to communicate questions and to submit your questions. Feel free to submit questions throughout the webinar. When you click on that Q&A box, you'll see a space open up for you to go ahead and enter your question. You can just type your question there, and you can press send. So there you go. There's the arrow for that. And then the other way that you can communicate with us is through chat. Chat will allow you to communicate with the panels and with the other attendees in this webinar. And you can see that there's an arrow there that you would point for the chat box, which will open up. You enter in your comment, and then you would just push enter, and it's sent to us and the panelists. Now, the difference between chat and questions is if you want to submit a question to the panelists, please do use that question and answer box. And if you want to chat a comment to the attendees as well as the panelists, use the chat box. That's a little bit different than what we've done in the past. And then lastly, I want to tell you about our raising your hand tool that's in Zoom. If we ask you a question like, have you seen your county snapshot? We would love for you to participate and let us know. You can use the raise hand tool. You see that icon is being pointed again at the bottom of your viewer screen. I think Justin's going to actually ask you a question very soon. So look for that raise your hand icon so you can participate with us. Thanks, Justin.
Yes, I just might. Thanks, Erica. Great, so we're going to get on to a bit of the content and move forward. So here at County Health Rankings and Roadmaps, we rank the health of nearly every county in every state, and we envision that data can be moved to action, whereby the rankings can be a catalyst for local community health improvement. The rankings model is one of our most important images because it shows what we use to determine the county health rankings and what influences health in a community. So for some of you, I know this image may be new or may not, so I ask everyone else to indulge me as I quickly explain the important framework. This model shows the relationship between policy, health factors, and health outcomes. The rankings make it clear that good health includes many factors beyond medical care, including housing, education, jobs, access to healthy food, and much more. It shows us that all these factors impact how well and how long we live. So starting from the bottom, we know that from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, which are the blue boxes in the center of the model, they shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, which we'll be talking about a bit today, and the physical environment. We also measure two types of health outcomes, which would be the green boxes at the top of the model, to show how healthy each county is. And this is by length of life and quality of life. So to get an idea of your familiarity with the model, we're just going to ask you to use the raise hand function Eric was just talking about at the bottom of your screen. And just click on it to raise your hand, just acknowledging if you've seen this model before, if you've seen it at all, or even if you've gone deeper into looking at it. And I'll wait just a few moments as hands go up and continue to go up. So as I wait, and I'll give you a tally on that in just a bit, I want to translate this theoretical model into a real life example that applies to today's webinar. So if you think about improving unemployment, maybe by providing job skills training and creating the conditions for employers to provide more fair paying jobs for all, this will lead to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing, which in turn influence health outcomes. So seeing that connection. Thanks you all for raising your hands. It looks like a third to a half of you were familiar with this model, so that's great. So next, I just want to briefly introduce our guest organizations. PolicyLink is a national research and action institute that works to advance racial and economic equity. I will let Angel introduce PolicyLink in much more detail, and also the National Equity Atlas itself in just a bit. Just wanted to welcome them into the room. And our second guest, again, Jaime, is from Urban Health Plan in the Bronx. Urban Health Plan is more than a federally qualified health center. It is a hub for multi-sector community improvement and economic development. Urban Health Plan engages and partners with areas like education, immigrant health access, private sector employers, and healthy food providers. Dr. Jaime Torres will have a lot of great things to tell us about the work that Urban Health Plan is doing in just a bit. So I really wanted to center us today in the concept of equity. In February, a partnership called the Convergence Partnership, which includes the Robert Wood Johnson Foundation, along with other major national leaders in philanthropy, healthcare, and public health policy, they issued a declaration statement reaffirming their commitment towards prevention and equity as core priorities. It's important also that, to know that PolicyLink serves as the program director for this Convergence Partnership. The statement reaffirms that place, or where we live, learn, work, and play, as being so important to our health. It supports that this is the work of the entire community to pursue prevention, to support fair inclusion, and to provide opportunities for all, especially for those struggling most with poor health. So while it is critical to see commitment to an equitable future, it is also crucial to remember our history. Specifically, we'll need an understanding of the historical contexts and conditions that have caused current inequities. In just a bit, you will hear Jaime talk about housing conditions and poverty in the Bronx, and it is important to clarify some causes. We often hear broad terms like structural racism and historic systems of oppression. So let's think about a concrete example involving federal public policy, discriminatory housing standards, and segregation. We know that access to affordable and quality housing is key to good health. Generations ago, during FDR's New Deal, the federal government started subsidizing certain housing. Some programs exclusively allowed whites to move into new suburbs like Levittown, New York, and to buy homes for around $8,000, or about $125,000 in today's dollars, while blacks were prohibited from buying these homes, even if they could afford them. This discrimination cut off opportunities for those in urban areas. But it's not just about trying to move out of urban areas. Over the decades, those suburban homes greatly increased in value, creating wealth that got passed down through generations for white families, supporting them to send their children to college and afford other life opportunities. Even though the law changed in 1968, allowing blacks the right to buy into places like Levittown, most homes increased in value and became unaffordable. Today, they're selling for, on average, around $500,000. So if we fast forward and acknowledging that there are many factors that influence health, if you compare the neighboring Bronx and Nassau counties in their county health rankings, Nassau is number 3 of 62 in New York State, and the Bronx is ranked at 62 of 62. Almost 40% of housing in the Bronx is characterized as having severe housing problems, while Nassau is at 23%, which is under the New York State average. Further, Nassau County median household income is triple that of the Bronx. We can connect this back to health through the County Health Rankings model, and also to some National Equity Atlas indicators that we'll learn about in just a bit. So by making quality housing more affordable, by providing access to homeownership and leveling the housing burden across race, this can improve health. In the short term, higher quality housing will improve indoor air and water quality, and in the long term, access to homeownership and/or decreased housing burden will increase wealth or family income that can increase opportunities for health today and in the future. So let's keep this guiding question circling today. As we discuss equitable economic development and its connection to health, and given that we know there are historical causes of inequities by place and race, how can you use these local data tools, strategies, and stories to understand and improve equity and development practices in your own community? So now, to take us through an equity data tool I'm very excited to be shared, I'm going to invite Angel to share the National Equity Atlas with us. Welcome, Angel.
Thank you so much, Justin, and it's really great to be here. My name is Angel, and I'm a program associate at PolicyLink, and I'm going to be presenting and sharing today the National Equity Atlas, which is the fruit of a long-term partnership between PolicyLink and the Program for Environmental and Regional Equity at the University of Southern California. I'm going to start with a few slides that provide some background and framing of the Atlas, and then I'm going to do actually a live walkthrough of the Atlas towards the end. So Justin already mentioned PolicyLink is a national research and action institute advancing economic and social equity by lifting up what works. And this tagline really underscores our belief that the people who are most impacted by equity actually hold the solutions. And it also highlights our focus on working with local leaders across the country to develop and hone strategies that advance equity. I also wanted to briefly mention another PolicyLink initiative called the All in Cities initiative, which accelerates the work of government leaders and community advocates to advance racial economic inclusion as well as equitable growth. So what is equity? Many of you are probably familiar with this image on the top right. We define equity as just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. But we recognize that you can't achieve equity without achieving racial equity. So racial equity is really front and center in our work. Moreover, achieving equity requires honestly addressing the reality, that bottom right image, and eliminating barriers and providing people with the optimal opportunity to thrive. In an equitable city, we like to say that your life chances and health outcomes are not determined by your race, ethnicity, gender, nativity, religion, disability status, etc. So why equity? And it's because you can have economic growth, but it doesn't necessarily translate to everyone being better off. So this table on the left is from the Brookings Metro Monitor, and it shows how even though all of the 30 metro areas listed experienced economic growth in terms of GDP, new jobs, increased productivity from 2000 to 2015, very few of them actually achieved inclusive growth in terms of greater economic or racial inclusion. On the right is a chart from the National Equity Atlas showing median hourly wages in New York City from 1980 to 2014. You'll see that the median wage of white workers, shown in gray, has increased in real inflation-adjusted terms from $26 an hour to $31 an hour. Workers of color, on the other hand, which we define as all workers who do not identify as non-Hispanic white, the median wage was actually stagnant over the same time period. As a result, the racial wage gap increased to $12 an hour by 2014. And you can see on the atlas that these racial wage gaps persist even when we control for education. So our central message is that equity will make cities stronger. One of our signature analyses is shown here on the left, and it really highlights that equity is not a zero-sum game. This is our GDP gains with the racial equity indicator, and it shows that in the New York City metro area, GDP could have been $476 billion larger in 2014 alone if we closed racial gaps in income. And a growing number of economists are also expressing concern about these persistent inequities and what they mean for the future economic prosperity of cities and regions across the country. So what is equitable economic development? We offer a definition. Equitable economic development unlocks the full potential of the local economy by dismantling barriers and expanding opportunities for low-income people and communities of color. It grows quality jobs and increases entrepreneurship, ownership, and wealth, which results in a stronger and more competitive city or region. Briefly, before I dive into that live demo, our partners at PEER manage the Regional Equity Indicators Database, which powers the National Equity Atlas. It covers 301 geographies listed here, the 150 largest metros, the largest 100 cities, all 50 states, and the United States as a whole. And it pulls from a variety of public and private data sources that you can see listed here. We organize the data or indicators on the atlas in this 5-part framework. The first part looks at demographics, who lives in the region and how is this changing over time. We then look at measures of economic health and vitality. Readiness really captures human capital, and connectedness looks at transportation indicators as well as segregation. And lastly, we close out with what are the benefits of racial economic inclusion to the broader economy. In addition to maintaining the atlas, our team has also worked directly with a couple dozen local communities now to create what we call comprehensive equity profiles for their cities or regions. And this is a map of those places. We've completed several in Mississippi, New Mexico, and Michigan for the Kellogg Foundation's priority areas. We've also produced 5 with support from the Robert Wood Johnson Foundation that more intentionally integrate our equitable growth framing with health equity. And those are the 5 turquoise dots that you can see on the map there. All of these profiles are publicly available on the atlas, and during the walkthrough, I'll show you where you will be able to find them. In addition to data, we also want to be able to connect advocates and decision makers to the policy tools that can actually move the needle on these indicators. We highlight a set of 6 inclusive growth strategies shown here that are really key to equitable economic development, including supporting industries and businesses that create good accessible jobs, raising the floor on low-wage work, and reconnecting historically disinvested neighborhoods to the regional economy. You can find examples of each of these policy buckets in our newly launched All in Cities Toolkit, which we'll share the link to at the end of the webinar. So before I jump into the demo, I just wanted to share a quick example of how local policymakers have used and applied our data. We worked with Fairfax County, Virginia, to create one of those equity profiles that I mentioned, and given the relative affluence of the county, many of the racial inequities really shocked decision makers. In response, the Fairfax County Board of Supervisors and the school board actually passed a One Fairfax resolution, which was a formal declaration of a commitment to racial and social equity. Now our team is actually working with the county to support the implementation of this resolution through embedding equity criteria into an RFP for the redevelopment of a 10-acre campus of a former high school. So this is just one of the ways that we hope to not only inspire state and local governments to take action, but to provide them with the data and tools necessary to do so. Lastly, I just wanted to make, if we can go to the next slide, just wanted to make a quick plug for the next PolicyLink Equity Summit that's going to be happening in April of 2018 in Chicago. The website, equity2018.org, is now live, and early bird registrations and scholarship applications are now open. Those scholarship applications are due next week, so please check that out. And I think the last slide just has my contact information, but we can go ahead and share that with you all at the end of the webinar. So I'm going to share my screen.
Thank you, Angel. As you're kind of setting up the screen share here, I just wanted to welcome folks to please enter their questions if you have any questions. I know that I myself would probably have a lot of questions into the question box, and we can hopefully pick those up at the end of the webinar to field those with our guests. And I'll turn it back over to you, Angel.
Awesome, thank you. So here we are at the nationalequityatlas.org, which is the homepage of the Atlas. And we created the Atlas to support local leaders and decision makers to better understand the changing demographics of their communities and how they're doing on a series of equity indicators. The homepage provides an introduction to a 3-part story and framework that has driven a lot of our work in the last several years. It starts with the fact that the face of America is changing, and by 2044, we will be a majority people of color nation. But inequity really threatens broader economic prosperity. The same communities that are driving population growth continue to experience inequities. The last part is our solution. Equity is the superior growth model. And in fact, the nation's GDP could have been $2.1 trillion higher in 2014 if we were to close racial gaps in income. If we scroll to the top navigation, you can explore the site through data summaries or indicators. Given the time that we have, I'm going to go right into indicators, which is the meat of the atlas, but that data summaries tab is a really great place to start digging in and seeing what the data story is for your community. The indicator section is where you can explore all 34 indicators, now available on the atlas, which are organized under the three subsections that I mentioned earlier: demographics, equity, and economic vitality, readiness, and connectedness, as well as economic benefits. We only have time to discuss one indicator today, and since we're talking about equitable economic development, I'm going to go ahead and show unemployment. And since we're going to be talking about the Bronx later, I already said it for New York City, but usually if you go to the National Equity Atlas, the default is the United States. Just a heads up, this Explore box does not work like a Google search bar, so you have to actually type in the city that you want to see and select it from the drop-down menu here, and then press Explore. Just a heads up. So here we are in the indicator section. The indicator pages all have the same basic structure. The first thing that you'll notice is the graphic display here. If you have questions about what a particular indicator means, you can just hover over this question mark to see a definition of the indicator, as well as a link to our technical documentation, which provides more information about methodology and data sources. Below the graphic, we offer framing and examples that can be used to help advocates and policymakers share this data and incorporate it into their work. This is something that really sets the Atlas apart from other data sites. Here on the left is our framing question, which helps you understand what you're looking for in the data. And below, you'll have some language describing the key points. So here you'll see in 2014, the average unemployment rate for people of color was 3.85 percentage points higher than the average unemployment rate for whites. On the right is the Why It Matters statement, which tells us why we should care about the particular indicator and what it means for equitable growth, and why addressing the data shown is actually beneficial for all of us. Moving down, we include specific strategies for addressing what the data shows. So these ones are policies to reach full employment for all. And below that, we have an example box of a strategy in action. This particular one talks about the city of Durham's Ban the Box policy, which was passed in 2011, that removed questions about prior convictions from job applications. And lastly, we have additional resources and links to other data sites, because we really want to be able to connect the data to actual policies that can be implemented. Going back to our graphic display up top, you can also download any of these charts for your own presentations and advocacy work, or share these graphics on social media. The first breakdown you'll see here is the trend line, but you can also look at by race ethnicity for a simple bar chart, and look at the data by education, which is how I'll look at it now. And just a heads up, if folks could not visit the National Equity Atlas for the next 5 minutes or so during this walkthrough, that would be really helpful, just because if a lot of traffic goes to it at the same time, it'll slow us down a little bit. So as I wait for this to load, each of these breakdowns actually also is by race. So it's by race and education, by race and gender, by race and nativity, etc. So when we see the by education breakdown, Black workers have the highest unemployment rates at all levels of education. And in fact, Black workers with some college or an associate's degree have a higher unemployment rate than white workers without a high school diploma. Again, you can also see how it varies by gender, by nativity, to better gauge how immigrants are doing. And the last breakdown before the map is by ancestry, which we added last year to be able to highlight really important within group differences that are often masked by overall averages. So the default we see here is the breakdown by ancestry for Asian or Pacific Islander workers, and we see that Bengali New Yorkers actually have the highest unemployment rate among API workers, and Japanese have the lowest. Underneath, you can also see the breakdowns within the Black population, Latino population, Native American, and white population. And you can also search just among US-born folks or immigrants. And again, the default is for all people. Lastly is our map breakdown. And this actually goes all the way down to the census tract level. So here we are, New York City. And just a heads up, there's a couple census tracts here that are white. And if you ever see whited out census tracts, there's either nobody lives there or the population in the universe is less than 100. So if I want to zoom in a little bit to the Bronx, you can see that a lot of neighborhoods are blue, and those neighborhoods represent areas where with the highest unemployment rate. So on the legend, you'll see areas where unemployment is 20% or higher. As you hover over different neighborhoods, you can also see not only the unemployment rate, but also the total number of people who are unemployed. And this can really help with targeting programs and outreach to areas with the highest need. You can also filter by demographics if you want to just see white unemployment rate. You can hover over and see the total number of white folks unemployed, and also unemployment rates for people of color. And you can see there's a lot more blue when we look just at people of color. Lastly, if you're interested in only looking at, let's say, Latino areas or neighborhoods that are majority Latino, you can use the filter to select Latino areas, and then this scroller allows you to go up to 50%, and then you can see a map of unemployment in majority Latino areas. So we're really excited about these interactive maps, which we have released for 4 different indicators now. People of color, race, ethnicity, unemployment, as well as disconnected youth. So I mentioned that I was going to show you where you can find those equity profiles, and in order to do so, you just click on reports, and here we have equity profiles as well as other reports and analyses that we've done. So in closing, the National Equity Atlas is a living resource, and the Atlas will continue to grow and evolve to meet the needs of local leaders working to solve the nation's challenges. So thank you so much for having me, and I look forward to hearing Jaime's presentation as well as our question and answer.
Thank you, Angel. That was fantastic, and a lot of really good information. So I'm going to work on just switching back to sharing my screen.
And Justin, if it's okay, this is Erica. I just want to remind our participants today to use the question and answer box at the bottom of your viewer screen to submit your questions. Some of you are submitting them in the chat box. That's fine. I am doing the best I can to collect those so we can ask some of our guests at the end of the webinar. So thank you very much.
Great. Thank you, Erica. And I just want to say thank you again to Angel for really lifting up this work and the tool to our more health-focused community, if you will, and really seeing some alignment in moving data to action. So I'm really excited to share this with attendees. So we're going to continue on with a little bit more of health discussion as we move into Jaime's work as well. Let's talk even more about local data and specifically discuss the Bronx as we queue up Jaime to talk about the successful work he's been working on with Urban Health Plan in the Bronx. Here you'll see a screenshot of our 2017 county snapshot for the Bronx. Now, remembering back to our model, the overall rankings for both health outcomes and health factors show that the Bronx is last out of 62 in both areas in New York State. I also circled where to click on areas to explore up top, which highlights the orange boxes below. And these are specific data points that draw attention for improvement. And you'll see there's quite a few of them in the health behavior areas there. This next slide is just a continuation of the Bronx snapshot, and it's a little busy, so please bear with me. Social and economic factors and physical environment factors, are also deemed the social determinants of health, make up 50% of what influences our health. So most of which of these are highlighted as those orange areas that need improvement, and I've circled that. They're related to today's webinar specifically because of the connection to economic development. Unemployment, for example, although it's trended down to 7.7%, was at a sustained level of 12% during and after the Great Recession, and as Angel reviewed, even more severe within Latino and people of color communities. Poverty can be portrayed by the median household income measure and the children in poverty measure. And further, as Angel pointed out, in order to work towards equity, disaggregating this data is critical. In this measure, you can see that the data is even worse for Latino children in the Bronx, nearly half of which live in poverty. I also wanted to call attention to our new measure of disconnected youth, also a measure aligned with PolicyLink that Angel reviewed. And this is located in the additional social and economic measures that are not expanded in this specific screenshot. And disconnected youth measure measures those between the ages of 16 and 24 that are not in school and also without a job. And it's at a rate of 23%, or nearly a quarter of youth in the Bronx. Youth and economic development are strongly connected in how we provide opportunity for the next generation. And this is especially important, seeing that over 25% of the Bronx population is under the age of 18. So Angel and I have provided a lot of data or quantitative explanations and support for equity arguments, but now let's hear from Jaime on some local data and also some excellent success stories around strategic partnering towards equitable economic development. So welcome, Jaime.
So should we begin?
Yes, you are on.
Okay. So you want to go, here we go.
Yeah, so Jaime, I'll just cue you off. To give us a start, please give us some background on Urban Health Plan and its historic role in the Bronx community and economy.
So Urban Health Plan is a large network of federally qualified health centers now serving 3 boroughs in New York City, but our home base is the Bronx. It arose from a history of persistence, determination, and commitment to the people of the South Bronx. It's really a compelling story. It was the idea and vision of a local Puerto Rican family physician, Dr. Richard Izquierdo, who grew up in the neighborhood. In 1967, he opened his clinic and worked as an urban country doctor. So not only he worked in the office, but did a lot of house calls. And at that time, even it was difficult, he treated everyone without their ability, regardless of ability to pay. In the 1970s, the Bronx experienced much social and economic changes, unrest, turmoil. The middle class and large businesses were leaving the borough. There was a wave of arson, mainly in the poorest neighborhoods, especially in the Bronx, South Bronx, which affected housing for decades to come, which led to increased crime, drug abuse, and poverty. Dr. Izquierdo not only stayed, but expanded to create a multi-service center that went beyond medical care. His vision was to create a service of integrated, coordinated services to, as he put it, to treat the neighborhood where we live in. For example, his clinic offered after-school boxing and karate classes, and on weekend, it hosted drug rehab programs. So with that vision, in 1974, that center became a FQHC, Urban Health Plan. So the plan was to improve the health and lives of the people of the South Bronx. As Justin noted earlier, and despite our history of community health work, according to the data, we continue to be in the last place in New York State, according to CHR. And even though since 1990s, the Bronx has seen a gradual rejuvenation and growth, there's still much work to be done. But we're staying headstrong in our persistence, determination, and commitment to the people of the South Bronx. And we are determined that a zip code should not be our destiny. So let me say more about the work that we're already doing. So 43 years later, we have grown to a network of 10 community health centers, 13 school-based programs, and very importantly, we offer an array of medical service combined with supportive services, which we'll see in a few minutes in other slides, that are central to the holistic approach we are known for. 8 of our clinical sites are located in the Bronx, one of the five boroughs comprising New York City, with a population as 1.5 million, as it was mentioned earlier, and we are the 3rd most densely populated county in the US, and still one of the poorest. Our Bronx sites are located in the 15th Congressional District, one of the poorest congressional districts in the nation, which has as a median income of less than $20,000. Approximately 80% of our patients are Latino, with African Americans comprising close to 20%. 78% of our patients are eligible for Medicaid. And the community also suffers from high rates of diabetes, asthma, obesity, HIV/AIDS, mental health conditions when you compare to the rest of New York City.
Thank you, Jaime. What excellent commitment and leadership really at Urban Health Plan's roots and as it continues today. I want to highlight too that the primary equity issue related to health in many low-income communities is really access to healthcare. And here Jaime has highlighted the wide range of medical services that the Urban Health Plan clinics offer to the community.
And in addition, Justin, we offer a myriad of supportive services that are part of our integrated approach. So for example, if you come to us and for a doctor's visit, in the same visit, you might see a nutritionist, a social worker, or a healthcare educator. Again, we want to make sure that those services are available on the same visit because this is part of the team-based approach that we're known for.
Yeah, that's great. So you're really addressing the social determinants in a clinical setting, which is fantastic. It seems evident that from the multi-site clinics you have and from your vast network of supportive services that you really embrace an approach of partnering. And I just wanted, maybe you could explain to attendees here, how do you pursue your community relations, or what are kind of your guiding principles behind how you do this partnership work?
So having in mind that our mission is to continuously improve the health of communities and the quality of life of the people that we serve, which includes having positive impact on social conditions, I would say that the best way to describe our guiding principles is that we go after concentric circles of impact. For example, in terms of our physical expansion, we open other health centers radiating from our main site, which is a 55,000 square feet facility. We're very large. So we have other 7 sites around the Bronx with that as a hub. Then we expanded to Queens, and last February, we opened a center in Central Harlem in Manhattan. Another circle is the direct impact we have in the 80,000 patients that we serve and the more than 900 employees. So yes, we're very large. That impact includes the quality coordinated care we offer, but also a robust package of benefits for our employees. We are the largest employer in the zip codes that we serve. And in fact, our turnover rate is only 11% when you compare that of national healthcare arena, which is really 19%. Besides health insurance and retirement plans, we offer $15 minimum wage. We offer tuition assistance for college, a management program to promote from within, and an extensive wellness program that includes classes on healthy cooking, Zumba classes, financial literacy, and much more. And in that second layer, we impact their families. We invest in our employees, which we call here associates, because it is the right thing to do, but also they are the ones who improve the living conditions in these communities. So we offer stable jobs with good benefits that turn into good purchasing powers in these communities. We also have an impact in the Bronx. First, by being one of the largest employers in the borough with multiple external health fairs and programs that we offer, including workforce, economic programs, and the many partnerships that we have created, which I will describe later. So we use the same model as impact in Queens and now in Harlem.
That was great, Jaime. Thank you. So, so with this kind of understanding of your theory, can you explain some of the process for fostering collaboration in the community around economic development and your community improvement efforts?
So as you can see, there's much work to be done to improve the life and conditions here in the Bronx. And one of the key ways to do this is by creating strong partnerships with other CBOs that offer non-healthcare services that are needed by our patients and the community. That is why this last year, after such a difficult election period that makes for so much uncertainty, we launched the Hunts Point and Longwood Community Coalition, bringing together 20 CBOs that are located in or served in these 2 neighborhoods, which are around here in the South Bronx. These are organizations that are respected with long-standing roots in the community, and they include a community college, senior centers and aging services, Head Start, art and culture, youth programs, harm reduction programs, domestic violence programs, legal immigration services, housing support, and much more than that. So for a long time, we have known each other, respected our work. Now we can work collectively. So our strength now is our connection. We work to promote greater cooperation and coordination of services. We collaborate to solve problems. And more importantly, we advocate for more funding to our community and much more work to be done.
That's great, Jaime. And just to bring some of the insider jargon out, if you're unfamiliar with CBO, that's just community-based organizations that we use in the field a lot. So I know that both the County Health Rankings and the National Equity Atlas incorporate education indicators and factors, since we know that education is connected to job readiness, employment, increased income, and ultimately health. So what are you doing in terms of education in the Bronx?
So we believe firmly that good education is the key for good health and economic success. I think we can all agree on that. That is why, in addition to our charter school, which I will mention in a minute, we partnered with New York City to enroll in the free universal pre-K program that includes our patients and employees. And we also partnered with the Fresh Air Fund, a program that every summer brings children from underserved neighborhoods to summer camps in upstate New York. Again, these are children who have never experienced nature outside our local parks. And this has been a great success in our community. Then, like I mentioned, we opened a charter school which arose from the need to increase graduation rates among Latino and African American students here in the South Bronx, and to hopefully encourage them to pursue health careers. The Dr. Richard Izquierdo Health and Science Charter School, which as you can see was named after our founder, is the first charter school in New York City to offer a career and technical education program geared towards preparing students for jobs in the healthcare sector. All of them have the opportunity to graduate with an EMT certificate, which allows them to get a job in a fire department or an ambulance company, for example. And last May, we're very proud to say we had our first graduating class, 76 graduates. But the majority decided to pursue college, very excited. So we are sure, very sure that those kids will not be part of the 23% disconnected youth rate that you mentioned earlier, Justin.
Great, Jaime, thank you. Your audio cut out for me just a bit, but I just wanted to make sure everyone heard that. And great kudos to the 76 grads and the fact that a lot of them are pursuing college afterwards too. So I just wanted to make sure the attendees caught that. So as you serve an almost entirely people of color population, Jaime, it's evident that inclusivity is not only ingrained in your work, but it really just drives your work. So beyond formal education, what are other ways you're achieving equitable economic development?
So we know that we have to develop programs that will increase employment, where we can train jobs for the jobs that are available here in the community, and we need to support local businesses so they can grow. So in order to do that, we have created these programs. Project Hope is our workforce development center, which was established in 2012 to assist the Hunts Point community area, where residents at that time had the highest rate of unemployment in New York City. So as the slide shows, these are some of the programs that we offer: career planning and job search, basic and advanced resume writing, job placement, job fairs. We offer a GED certificate because, again, these are many of the young people who never finish high school. We offer English as a second language, and then we also, since we're there, we do referrals for healthcare and health insurance in case they don't have it. Also, Project Hope also provides OSHA safety training, which is a key qualification certificate that is necessary for many of the industrial jobs available here in the Bronx. And we're very excited because we just launched a new project to provide technical assistance to small businesses in the neighborhood. We offer minority and women-owned business certificates, which are essential for small businesses to obtain access capital and to apply for government grants and contracts. And as I continue to explain our work, as you have heard me say in the past, Justin, it is so important never to lose track that the fact behind most of the social determinants of health is the leading cause is poverty, plain and simple. So we can do a great job controlling your asthma or diabetes, but if you go back to a roach-infested apartment or a polluted environment because of the massive number of trucks traveling in the area, or if you don't have a job, or even a high school diploma, you will not stay healthy. So let me give you an example of where, when you think about treating one person or one segment, you end up dealing with the whole family. In our network, we sell 5,272 older adults. These are 65 and over. 59% of them live below the 100% poverty line, which translates into less than $11,700. Keep that in mind, $11,700 living in New York City. 7% of them live between 101 and 150 poverty line, which is around $17,000. And we know that 65% of them live with a family member. When our social workers go a little bit deeper, we learn that many are grandparents raising grandchildren, which needs extra support. Often there may be 1 or 2 generations living together for the lack of housing. But worse, in many cases, it is grandma the one who's paying for rent and utilities, even food. And that's why we offer a pantry program for that population that comes once a month. So there's much work to be done to lift those families out of poverty, to keep those families healthy and on the path to economic security. So with that understanding, our economic development is very much connected to our community development. Another program we support is the Hunts Point Economic Development Corporation, which was founded in 1988, but for the past 2 years, it has come on the wing of the Urban Health Plan family. So we have broadened our work to include not only healthcare, but also community development. We feel that as an anchor institution in the Bronx, we need to exert leadership in this area and support small businesses that are really at the heart of the local economy and the source of so many jobs in the community.
I mean, that's fantastic. And it kind of begs the question, what you and Urban Health Plan isn't involved in the Bronx. This is a really great story. And I want to kind of continue how comprehensive your development work really is. So you've explained to me that the Bronx is the location of one of the largest food market distributors on the East Coast, but their revenues and jobs do not necessarily directly benefit the Bronx. Could you maybe explain some efforts that you're doing to change this pattern?
You're absolutely right. This is the largest distribution center in the East Coast, but those jobs are insular. They remain to the people who have connections there. They never benefit our community, and also that money doesn't stay in the Bronx. So we're very excited to partner with an economic venture in the Bronx called Bronx Exchange that aims to keep all the money created in the Bronx so it can stay in the Bronx. There are many large anchor institutions like us that would end up purchasing materials, supplies, and services outside the borough. So the Bronx Exchange is an online platform that connects purchasers with local vendors so they can do business. But it also provides innovative financial tools which allow a small business to be paid within 30 days, when a large institution like us may pay its bills on a 90-day cycles. Something that small business cannot allow. For example, let's say a small printer in the area cannot afford to wait 90 days to get paid. So we decided to support this venture, and it continues to grow. The last item on the slide I think is very important. It is our commitment to have USP employees to be part of community boards. There are 59 community boards in New York City, and it's the most on-the-ground form of local government. They advise on land use and zoning, they participate in the city budget process, and they address health, youth, economic development in the district. So this ensures that those decisions will be on behalf of the people in that community and not to serve a developer or a large corporation that wants to land here in the South Bronx.
I mean, that's really a great example of the work we're really talking about during this webinar, and I think that that message about having both the community resident engagement in decision making, but also in ensuring that there's community benefits involved in all the decisions that are made is supremely important. So I really want to thank you for sharing that. This has really been excellent. I want to offer you just one last comment as to maybe why a federally qualified health center has been so successful in this work.
So I would say that the main reason of the success is that we have been sticking to the vision of Dr. Izquierdo, which is individual health and community health have to go hand in hand. And I'm very proud that that vision is now led by our CEO and president, Paloma Hernandez Izquierdo, who happens to be his daughter. So that vision and mission is really, it's distilled down everyone here, because we believe in improving the life of the community. But an important thing also is that this organization is willing to take a chance on the community, and sometimes will expand in areas that other organizations might be a little bit hesitant. But the decision making is, if it's good for the community, we're going to take a chance on it. I think that would be the best way to describe it.
That's excellent. That's really fantastic to know that, you know, you maybe have to assume a little risk in the short term to understand the real importance of an investment in the community in the long run. So thank you, Jaime. We're going to come back to you when we get to the questions and answers. And beyond the robust partnership work that Jaime just explained towards equitable economic development, there's some other great stories to tell about the Bronx. They were also a 2015 Robert Wood Johnson Foundation Culture of Health Prize winner. And part of their success is really in positively spinning their lowest rank to galvanize some good energy to not be number 62. So hence the hashtag not62 evolved, and this campaign has become really a movement to build a healthier Bronx. So if you're new to and kind of curious about the prize, the Robert Wood Johnson Foundation Culture of Health Prize recognizes communities that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest barriers to good health, the opportunity to live well. To learn more about prize eligibility, criteria, selection process, key dates, and to apply, you can go to rwjf.org/prize. You can see that the applications are due this November 3rd, 2017. So time to get to work on that if you're thinking about it for this year, or to gather maybe some partners to think about applications in future years. Here you'll also find some past prize winning videos like the Bronx we just discussed. So now I want to turn it over to Erica to hopefully start fielding some of our questions. And as she does so, I'm going to be sharing these great photos here from that Jaime shared from the Bronx Health Expo. And I'll also be going back and forth with a resources slide from Angel and on the National Equity Atlas and their work too. So to you, Erica.
Thanks, Justin. And I just want to thank everyone for just sending in these awesome questions. And we're going to try to get through as many as we can. I have to stop, though, and give a shout out to those who are participating from the Not 62 campaign. Fernando, thank you for sending us that shout out about Not 62. Angel, I'm going to start with you. One question that came in is, how can we communicate about equitable economic development to policymakers and community leaders?
Yeah, so one of the central reasons that we created the National Equity Atlas was really to help local leaders make the case for equitable economic development. And a good place to start out is with those data summaries. I didn't have time to show them in the walkthrough, but they are available for all 301 Atlas geographies. And the summary provides, with local data, the story of why equity is not just a moral imperative, but also an economic imperative. And this can really help to bring, those folks who might otherwise not really respond to the moral imperative to the table.
Right. And Justin are sharing some of those resources that you have. And I do want to remind our audience that these resources will also be shared with you and in a link that you will receive for attending today's webinar. So thank you so much, Angel. Jaime, I'm going to toss it back to you, and you will go ahead and need to unmute yourself. But a couple of questions came in related to this about how can we ensure that marginalized populations are involved in economic development decisions and conversations and decisions.
what I mentioned about the community board in New York City, which is kind of, again, is the lowest type of government in the city. These are volunteers who obviously it spend a lot of time in those meetings, but they have the pulse of the community and they make decisions that in the long term can affect the community. Let me give you a tangible example. There's a lot of development and construction going on in the South Bronx. So the zoning, they are the ones who will approve a project in the neighborhood, and they will approve it with certain caveats. It had to make sure that it will be affordable. There have to be a certain amount of jobs have to be offered to the people in the community. And also they want to make sure that they will offer contracts to women and small businesses that have that certificate. That's why it's so important to have it. But also an important thing about that project is that not only housing has to be what we call affordable, but also they have to be different levels, because we have many millennials who are in the Bronx, they grew up in the Bronx and they don't want to leave the area. So they might be making $40,000. They cannot afford to live in Manhattan, but if we find apartments, maybe a studio apartment that will be available to them at that price range, that will ensure that they will stay here in the Bronx and they become their place to live and also to grow in small businesses. For example, we have developed a couple of coding organizations run by millennials and that are new here, and they're dying to stay and live in the neighborhood. So for example, those type of decision-making aspects that are in the community boards are essential to make sure that they stay and that we grow in a way not only to lift up the people who are maybe poor, but also to maintain that new generation who want to remain here, recent graduates, and they want to be able to be part of the growth of the Bronx.
Yeah. That makes sense. Thank you so much for that. Justin, to close out the webinar, I do want to say that if we did not get to your question, I apologize. We just have so many good questions coming in, and perhaps we can get to some of your questions offline. I'll also be sharing contact information with our guests today, so you can contact them as well. Now, one of our participants want to know, how frequently will the data in the equity map be updated?
Yeah, that's a great question. So we just added those maps in the last 6 months or so, and we are going to try to update all of the data in the atlas about every 2 years. It really is a big undertaking because of all the different geographies that we have. So the 2015 data is already out, but we'll probably update it again when 2016 comes out.
Okay. Hami, I'm going to let you have the last question before we turn things back over to Justin. One of our participants wants to know, have you all considered a partnership with legal aid?
So one of our partners in the Huntswood Longwood Coalition has a legal services that already have been working with our community, but we do work with legal aid when we have done, for example, Know Your Rights forums in the neighborhood. They have been the ones not only provide personnel to be part of that forum, but sometimes even speakers. But we're beginning, again, we're very concentric. We want to begin with community-based organizations that are in the neighborhood or serve the neighborhood, and we'll continue to expand accordingly.
Thank you. Thank you so much. Justin.
Great, thank you, Erica. Excellent questions, and I'm sure folks have a lot more, and I'm going to try and get through these last couple slides. And the first one really is talking about another opportunity to engage in some of these questions. It's a learning opportunity that's what we're calling a discussion group, and it's next Tuesday, October 31st at 3 p.m. Eastern, and it's a kind of a post-webinar discussion where both Jaime and Angel and maybe even another guest from PolicyLink will be able to join us. And it's an open dialogue with folks that are attending and other colleagues across the nation about what you've learned today, what you want to discuss, maybe things you want to share that you're doing in your community. And this conversation is different than other webinars in that it's really facilitated interactive discussion to share, and so kind of come with some ideas or some stories or some questions to bring into the space. Video conference, highly recommended for this, so you can meet others and talk face-to-face, if you will, to build a strong network. There's limited capacity, so sign up early this week, and we really encourage you to submit some questions for that event. Also, lastly, if you'll be attending the American Public Health Association's annual meeting, please stop by our booth in the exhibit hall. We would love to meet you. I won't be there myself, but a lot of our folks will be there. Erica won't be there either, but you'll meet some great folks from County Health Rankings. Here's some photos of us from 2016 back in Denver. So lastly, please stay connected through social media and our newsletter. And a heads up for another upcoming webinar on economic development, this time focusing on rural areas and one local coalition story about working to really address living wage. That's coming up November 7th, I believe. And lastly, just a huge thank you to our excellent guests for sharing their time, their expertise, their resources, and their stories. And I want to thank you, the audience, for taking the time to participate in today's webinar, and have a great afternoon.
Thank you, everyone.